The video you're about to see has been recorded by the staff from Mount Auburn Weight Management Center. And we'd all like to share with you why we think that surgery is a viable option for anybody that has a weight problem and qualifies for the surgery. The surgery's been around for about 80 years. It's not new. It's not a curiosity. It's not for people who are just desperate. And it's certainly not an easy way out. It's a legitimate intervention for the disease of obesity. And myself now and the staff are going to go through a whole series now to demonstrate what weight loss surgery is all about. My name is Dr. Izzy Greenberg. I'm a behavioral health psychologist here at the Mount Auburn Weight Loss Center. And if you qualify for weight loss surgery, you might want to consider it as an option for yourself. And now I'm going to tell you why you're here, what obesity is, and why you should consider weight loss surgery as part of your treatment plan. Most overweight people have certain things in common. Most of you are walking around right now close to your highest weights ever. Most of you have already been heavy from an early age on, either from the age of 0 to 7 or through adolescence. Most of you have a close relative, a parent, a sibling, a grandparent who also is obese. You may even know people in your family that have had the surgery. Most of you had tried numerous times to lose weight, and all you ended up doing is putting it back on again. And probably most of you have some sense of embarrassment that you're even listening to this and considering weight loss surgery. Because after all, society looks at this like it's a cop-out, an easy way out, cheating, not trying hard enough. You might be feeling a sense of embarrassment that this is what you're resorting to. Society looks at this, and maybe you do as well, as taking the easy way out, taking a shortcut. Why couldn't you do this by dieting? Why are you a failure? How do you let yourself get this way? And you don't have any willpower. This is how society thinks. It uses a language of psychology. It blames overweight people for being overweight. Overweight people blame themselves for being overweight. They blame other people for being lazy, no willpower, not trying hard enough, giving up too soon. That's a whole terrible language we use for blaming overweight people for something that they really didn't do. This is all a terrible language, and it's nonsense. It's completely wrong on so many levels, and I want to cover some of that with you. So let's start with the definition. What is obesity? Obesity is three things. It's a chronic medical disease. It's not psychological weakness. It's not lack of willpower. It's not laziness. Obesity is a chronic medical disease. It's chronic. Chronic means it doesn't go away. There's no cure. Not with effort, try hard as you want to, not medications, not surgery. Surgery doesn't cure this problem, not hypnosis, not religion. You can control it, and that's what the surgery is going to help you do and will work with you, but it doesn't go away. It's a disease. It's defined by a high set point. It means your body wants to be big. The reason you're heavy, you're living in a body that wants to be big. And we don't think that set point comes down ever. In other words, for the rest of your life, you're going to have to fight this disease. You can fight it and control it, but it doesn't go away. And finally, it's medical. It's real. It's a medical phenomenon. It's not due to laziness, imagination, weakness, willpower, none of that. The hard part here is that it doesn't look like a disease. It looks like weakness, because after all, if you eat less, you lose weight. So how could that be a disease? When you eat less, you lose weight. You've done it so many times before. How could that be a disease? Well, the key thing to know about weight loss is that while you can lose weight, and millions of people do every year, the odds of keeping it off for more than a year or two are exceedingly slim. In other words, the huge majority of people who lose weight by dieting, doesn't matter what kind of dieting, they end up putting it back on again rapidly, completely, and then some, usually within a couple of years. So that each time you lose weight, within a few years, you're heavier than when you started. We call that weight cycling. And all these commercial programs have no data that show that people can do well 2 years out. They're all short-term weight loss. These weight cycles continue all your life, and with each time you lose weight, you get heavier and heavier as you put it back on again. Few people escape this fate. Remember, obesity is a chronic medical disease. It's not imagination or willpower. So, let's talk about the surgery. The surgery is not a cure. It won't bring your set point down. It doesn't make you exercise. But it's an incredibly powerful tool to help you lose weight, even in a big body. And with work, you can actually keep this weight off. So it's unlike anything you've ever tried before. The work you need to do, and we'll do it with you, we'll teach you everything, we'll work with you both before and after surgery. The work's called behavior change. It's a combination of many things, including exercise, and you will have a realistic chance at losing a significant amount of weight, and for the first time in your life, maybe having the ability to keep it off. There is nothing like this. It is a huge process, and we think that you have a good chance of success, whereas with dieting alone, it's just very, very difficult.
Hi, I'm Dr. Vosberg. I'm one of the bariatric surgeons at Mount Auburn Hospital, and along with Dr. Kim, my partner, we perform the weight loss surgeries here. I'd like to talk to you a little bit about weight loss surgery. One of the first questions we always get is who should have weight loss surgery? One of the best ways to take a look into this is by calculating something called your body mass index, or your BMI. BMI can be found by using a calculator like the one at asmbs.org. You put in your current weight and your height, and it will give you a number that represents your body mass index. Anybody with a body mass index, or BMI, over 40 is a good candidate for weight loss surgery. And people who have a BMI between 35 and 39 are also great candidates for this surgery, especially if they have diseases that are related to obesity, things like diabetes, high blood pressure, sleep apnea, and many others. One of the things about obesity that we have to remember is obesity is a disease. And not only is it a disease, but it's a life-threatening disease. It causes really significant health problems. It's chronic, which means it lasts for a person's life. And it's multifactorial. And what that means is that there's a lot of different causes, not choices that we make necessarily. It's really based on our genetics and our DNA, amongst other things. And obesity increases the risk for serious conditions that involve every organ system in our body. So these are things like lung disease, sleep apnea, liver disease like fatty liver disease and cirrhosis. It worsens arthritis, can cause gallbladder problems. It can cause infertility issues with both male and female patients. It can cause problems with our veins, problems with our arteries that can lead to strokes. It leads to heart disease. Very significantly, it causes diabetes, high cholesterol, high blood pressure, and even certain types of cancer are associated with obesity. But the good news is whenever patients are able to lose weight and keep it off, their risks for all of the diseases that are listed on this screen now significantly go down. What we found is that a person has to lose about maybe 5 or 10% of their starting weight to really decrease those risks for diseases. But the reality of things are that people with the disease of obesity, almost nobody can keep the weight off for a very long time with just diet, exercise, and medications alone. The people that see us, patients who are morbidly obese, often continue to gain weight over time. So a person's weight whenever they're 30 years old is often lower than it is when they're 40 or 50. Those numbers tend to creep up over time. Bariatric surgery, which is the same thing as weight loss surgery or metabolic surgery, is the only proven treatment to significantly reduce a person's weight down well below that 5 or 10% number where the medical problems get better. And really importantly, it's what we call durable weight loss. So once a person loses the weight, they're very likely to keep it off for the long term. That's the most important thing. All the bariatric surgeries that we do here at Mount Auburn are what's called minimally invasive or laparoscopic surgery. So the picture on this side of the screen over here with the small incisions, that's what we do. The incisions are about the diameter of your finger. They're very small. And we use special long instruments and a camera to work on the inside of the body. Patients who've had stomach surgery before, we also do laparoscopic surgery for those patients. And what this does is it helps people recover from surgery and get back to feeling their normal selves much more quickly than traditional open surgery where we make a bigger incision. There's two different great surgical options for weight loss. Lots of people have heard about them before. One is called the gastric bypass. The other is called the sleeve gastrectomy. And I'll tell you a little bit more about each of these. So gastric bypass, also known as laparoscopic Roux-en-y gastric bypass, this is kind of a blown up version of what our intestines look on the inside. A very small pouch is created in the upper part of the stomach. It's about the size of your thumb, or maybe say 3 or 4 ounces after it's made. That's connected to a piece of intestine that bypasses a significant portion of your stomach and small intestine. So this surgery does two things. One, it helps patients feel full much more quickly after they eat. And two, it reduces how many calories and nutrients are absorbed in the GI tract after people eat. So it keeps your portion size small, and also helps suppress hormones that make us feel hungry. This surgery also does something very special by increasing what we call incretins. And what that means is that it makes our bodies more sensitive to insulin. So it really helps people with diabetes or other metabolic problems like polycystic ovarian syndrome. Gastric bypass surgery is for sure the best option for patients that have something called Barrett's esophagus. Your surgeon will talk to you about that if you do happen to have this. And it's also a very good option for patients with very severe heartburn. So these are people that take medicines every day and still have acid reflux symptoms. Sleeve gastrectomy surgery, this is a blown up view of what our stomach looks like. So when we swallow food, it goes from the mouth down the esophagus into the stomach, then passes into the intestines. In sleeve gastrectomy surgery, we take off about 80% or so of the outside part of the stomach, and it gets removed from the body. This really decreases the volume of our stomach, and I always tell patients it turns a 6-lane highway into a dirt road. So we eat much more slowly, and we feel much more full quickly after meals. Also, very importantly, this surgery decreases hunger hormone production. Your stomach makes hormones that tells your brain that you're hungry. And whenever the levels of those hormones go down, people are able to stay full and not require as much meals or snacks throughout the day to make sure that they stay full all the time. This surgery also helps with diabetes by increasing incretin release. And this surgery doesn't involve any rerouting of the intestine or new connections in the intestine. And I would say about 95% of our patients choose sleeve gastrectomy surgery, and it's the most popular weight loss surgery in the United States. Anytime we do weight loss surgery, if a patient has something called a hiatal hernia, we also fix that at the same time. Your diaphragm is a big flat muscle that sits inside your abdomen, and there are openings in the diaphragm where things pass through, like your esophagus. If that space opens up a little bit too much and your stomach moves where it's not supposed to be, that's what a hiatal hernia is. You usually wouldn't feel a bulge or have any pain. It can cause heartburn or problems with swallowing. Just as an FYI, we usually repair these whenever we see them. About 9 out of 10 people with obesity, believe it or not, have at least a small hiatal hernia. And fixing this is very important when we do these surgeries because it helps patients not to develop heartburn afterwards. This doesn't add very much time to the operation, maybe about 15 minutes, and it also doesn't change your recovery time at all either. So what's the benefit of weight loss surgery? Well, what we found is that a patient who starts out, say, at maybe 300 pounds, total weight loss really for anybody is about 20 to 40% of where they start. So for that patient that weighs 300 pounds, we would expect them to lose somewhere in the neighborhood of 60 to 120 pounds after either gastric bypass or sleeve gastrectomy surgery. Weight loss usually happens over about 12 to 18 months after the surgery is completed. And exactly how much weight a person loses depends on their genetic background, their metabolism, and their body composition, not really which surgery you choose. And very importantly, the majority of obesity-related medical problems, these are things like heart disease, high blood pressure, diabetes, stroke, sleep apnea, and many, many others, almost all improve, which means they get better. Patients may have to take less medications to manage these diseases, or many diseases even resolve after surgery, and that means that you don't have to take any medications for the disease, and there's no detectable signs of it. So this would be like a person that has normal blood sugars a year after surgery and doesn't take any diabetes medicines anymore, or somebody who's taken blood pressure medicines their whole life is able to maybe come off of some or most of those, and their blood pressure numbers are better. Anytime we do surgery, there are risks associated with it. An important way to think about bariatric surgery is the risk is almost exactly the same as having your gallbladder or your appendix taken out. So there's a 0.1% chance of something catastrophic like death happening. It's very rare, and this is considered a safe surgery. What's even more important to remember is the mortality rate, and what that means is the risk of a person dying who qualifies for bariatric surgery but doesn't have it is actually higher than the patient who undergoes surgery, loses weight, and lives a healthier version of their life afterwards. Morbid obesity, and that's those BMI numbers we talked about earlier, when the number's higher than 35, we think of morbid obesity as being the case, is associated with a shortened life expectancy. And we've actually found that bariatric surgery after reviewing literature, really shows that it not only reduces the risk of dying from those obesity-related diseases, but it also adds healthy years to patients' lives. It's one of the few treatments that we have out there that's able to do this. The hospital stay, whenever patients have surgery, usually the surgery itself takes about an hour or two. People are under general anesthesia for this surgery, so you won't wake up, you won't feel anything, you won't remember anything during the surgery. Most patients stay overnight in the hospital for one night and go home the next day in the late morning or early afternoon after surgery. Patients are able to eat and drink liquids the day of their surgery and then are on a modified diet over the next several weeks, and we'll explain very carefully to you exactly what that entails. People can walk, take the stairs, do very normal things at home right away. The only restriction after surgery is no heavy lifting, which is more than 10 pounds or about a gallon of milk in each hand, for 10 days after surgery. And most people are back to work feeling like their normal selves about 10 or 14 days after surgery. The Weight Management Center is here for you. Your surgeon, which is myself, Dr. Vosberg, or my partner, Dr. Kim, follow patients for life after surgery, because like we talked about, obesity is a disease, and it's very important that we manage it not only with surgery, but also with diet, exercise changes, and really follow patients and help them with any ups and downs that occur after surgery for the rest of their life. Thank you very much, and we look forward to meeting you.
Hi, I'm Christine Seitz, and I'm one of the dietitians here at the Weight Management Center. We'll work with a registered dietitian both before and after surgery as part of your care team. In your one-on-one appointments, we'll work with you to review your food journals, provide guidance on choosing foods that help you reach your goals and advance your diet after surgery. We'll review any preferences or intolerances that you may have and give you some individualized recommendations to help you meet your goals. We'll review your lab work and monitor for vitamin and mineral deficiencies and provide ongoing support both before and after surgery for you. Protein is a very high priority nutrient after surgery. You'll hear us talk about protein in the office a lot. It helps with wound healing, it helps to promote weight loss, it promotes satiety, which means that it helps you to feel fuller for a longer period of time, which is very important if you're eating smaller meals. And it helps to preserve your muscle mass to protect your metabolism after weight loss. We want you to include a good source of protein at every meal, and your daily goal after surgery will be 60 to 80 grams a day, but we'll help you to meet that goal. Your feelings of fullness may change after surgery. Now you may feel full in the lower part of your belly. You might have that bloated feeling. Sometimes it feels like your pants may be a little bit too tight when we eat too much. After surgery, that feeling of fullness may change, and you might feel it higher in your chest, almost like a pressure in your chest or your upper abdomen. Sometimes people will feel a little bit of discomfort after eating, especially right after surgery in that healing process. You might feel uncomfortable after eating if you're eating too quickly, if you're eating too much, if you're not chewing your food well enough, or you're eating foods that are too dry. So we start to practice those habits before surgery so that it's a little bit easier of a transition afterwards. After surgery, you'll add things slowly back into your diet as you heal and recover. In the hospital, the first thing that we'll give you are clear liquids, and that gives you an opportunity to try different fluids and see what might work best for you when you go home in order to stay hydrated. Before you go home on that second day after surgery, we'll give you stage 3, high protein, full liquid. And so at that point, you'll start to incorporate things like protein shakes, yogurts, and cottage cheese. You're on that for about 10 days, and then we'll move you on to stage 4. Stage 4 consists of soft, moist protein. So we'll be able to add in soft meats like chicken and fish, eggs, and other high protein meats. And we'll also be able to incorporate some soft cooked vegetables. We want things to be fairly soft still at that point because you are still healing, and we don't want anything that's going to cause any discomfort or any irritation. You're on stage 4 for about 3 to 4 weeks, and then we move on to stage 5. Stage 5 is your lifelong diet after surgery. It's low fat, low sugar, and high protein. So at that point, we'll start to add in some raw fruits and vegetables, and we'll also add in a little bit of carbohydrate. You're on stage 5 by 4 to 6 weeks after surgery, but it tends to be a little bit slower of a transition as people start to incorporate other foods on stage 5. Everyone's an individual and may tolerate things at different levels after surgery. In terms of overall nutrition, for everyone who's looking for a balanced, healthful diet, what we recommend at mealtimes is about 50% vegetables, 25% protein, and 25% carbohydrate. After surgery, you can see that that distribution stays about the same. You'll be doing 50% vegetables, 25% protein, and 25% carbohydrates, so things like potatoes, rice, pasta. But you can see that the plate is much smaller. And that gives you an example of what that stage 5 diet might look like for you. Here at the Weight Management Center, we focus on developing good habits before and after surgery to help you have longer term success and to make those more of an ingrained lifestyle choice. We'll always work with you for your dietary preferences and lifestyle to help you reach your goals. We want you to still enjoy your food and have something that works for you and works for your family. So I hope to see you in the office soon. Take care.
If you've tried enough weight cycling diets, and if you think that weight loss surgery might be an option worth considering, please visit our website. You've heard from me, you've heard from our surgeons, you've heard from our dietitians, and if you go to our website, you will learn even more about our programs. There's a video there on the surgery, and you can download an application. We'd be happy to work with you to find the best possible weight loss solutions to your problems. Go to our website, take a look, weightmanagementcenter.org.